Nessa Childers, I know you're funding this conference being held with the ICP in the autumn. What are your motives for funding the conference?
Well, I was a psychotherapist and I want to give something back to my profession, to do something for which I have the resources now. And also as a politician, as an MEP, I've been involved for years with mental health interest groups, and that's the sphere in which I work. So all those things.
So the conference is looking at having psychotherapy, in the health service as part of a connected, integrated health service. What role do you see psychotherapy having in the health service?
Well, I think it should be part of primary care. I think it should be in mental health centres, if you like, as well as where GPs work. But most of all, it should be accessed in a way that isn't necessarily medical. People should be able to access psychotherapy in the public service, not have to pay for it, which they do now, and it should be as long term as is needed, because really the idea of something like 12 weeks for a lot of people in the public service is not going to work. In fact, it could be damaging in itself.
Because just to explain that, at the moment, if you're a public patient and you're referred for psychotherapy, which can be difficult enough as it is because there's very limited services, you only get 12 weeks psychotherapy, is that it?
Well, you get not long enough. It probably varies from 12 weeks, but it's not long enough. It should be open-ended for certain people. They need possibly lifetime support, and this is something we've discussed at the European Commission in the framework programme that's being developed. It's not possible simply to place a limit on it like that.
Because, like you say, the European dimension is, like the European Commission, there's a 5-year joint action plan on mental health. Tell me about that.
Well, I was at many of the meetings at the very beginning of the creation of this action plan, and it basically is quite simple. It's setting a framework for mental health to be part of all the other, if you like, working areas of the Parliament, like employment and social affairs, for instance. So there have been many meetings on the effect of mental illness on people's working lives and how to deal with that, and connecting best practice with all the different scenarios and all the different member states, because remember there are different means of access to psychotherapy in other member states. In Germany it would be easier to access psychotherapy, but in some of the perhaps the Central European countries it would be more difficult. But that we need to bring everything up to a level that every member state can live with, and their people.
Because we know a lot about our physical health, and we have a whole system that's in place, to help us keep our good physical health. But what you're saying is our mental health is as important, is equal to our physical health.
Oh, absolutely. And of course the issue of stigma comes in there, because we really need to begin to educate people more and more, not only about mental health and depression and schizophrenia. We have quite a lot of that kind of communication going on. There are more and more people that are in the public eye talking about their experiences with depression. But that's not enough. We need to educate people about psychotherapy, because people need to be able to access psychotherapy without a stigma attached to it. And certainly when I worked, there was still an anxiety that it would be discovered that they were, and people felt a certain amount of shame that they were engaged in something that they felt might be a sort of weakness, if you like. There's a lot of work to be done about communicating psychotherapy. What is it? What people need to know when they're looking for somebody.
And so this conference will be on that theme of integrating psychotherapy into the mainstream health service and having it part of what we do.
Oh, absolutely. And maybe we need things like consultant psychotherapists as well as psychiatrists. Not all psychiatrists are psychotherapists. In most countries it's a separate profession, a separate training, and I think that's really important to stress when people are looking for psychotherapy, that a psychiatrist isn't necessarily a psychotherapist. Many of them are now. They have separate training, but we need to get this across, and we need to encourage professionals to actually become psychotherapists and to access training themselves.
So come along to the conference in October and you'll hear a lot more there, won't we?
Absolutely, and that's the place to be. This is an introduction that's leading into that.